hi. It's time for concepts again. Today we are going to be looking at hepatitis B serology. A very interesting category or concept that you may want to know. And I believe it will go a long way to help you in understanding a lot with regards to hepatitis B infection. All right, today we are going to be looking at hepatitis B serology because, first of all, hepatitis B has a complex understanding. Why am I saying so? Because among all the hepatitis serotypes, it is only hepatitis B which is having a DNA. It has DNA. Okay, hepatitis B has DNA, meaning that it's double-stranded. Unlike the rest, that will be hepatitis A, C, D, and E. They are RNA. So due to the complex morphology of hepatitis B, we are going to be looking at its serology, unlike the rest, which are RNA. So that's one key difference between hepatitis B and the other types. That's the hepatitis A, C, D, and E. Hepatitis A, C, D, and E are RNA. They possess RNA, whilst hepatitis B possesses DNA. Okay, let's delve into the serology. So we are going to look at the structure of the hepatitis B in the simplest of manner. So we will take this as the surface of the hepatitis B. We will take this as the core, and we will take this as the envelope. Okay, the space between two membranes. So the core and the surface, that space between the core and the surface, we'll refer to it as the envelope. So we are going to look at the antigens first. Then after that, we'll look at the antibodies. We are going to look at each of them with their clinical significance. And when we are done with that, we then look at how to apply it clinically. So let's take the first one. We'll take this as the hepatitis B surface antigen. Hepatitis B surface antigen. So this one that we are looking at, the first one, we'll call it hepatitis B surface antigen. This is how it is written, hepatitis B surface antigen. So that is the one, hepatitis B surface antigen. Hepatitis B surface antigen. So the antigen located on the surface of the hepatitis B, the surface membrane of hepatitis B, we refer to it as hepatitis B surface antigen. The next one is going to be the antigens that are located within the envelope. So we'll have, so let's take this as the antigens located within the envelope. So antigens within the envelope, we'll be regarding them as hepatitis B envelope antigen, or we can also refer to them as hepatitis B escape antigen. Why are we saying escape? Because they are able to escape into the blood. Okay, they are able to escape from the structure of the hepatitis B into the circulation, into the blood. Because of that, we'll call them hepatitis B escape antigen. But because of the location, for the fact that they are located in the envelope, we'll refer to them as well hepatitis B envelope antigen. So either you are calling it as hepatitis B escape antigen, or you are calling it as hepatitis B envelope antigen. So it is represented with hepatitis, as you can see, as I've written, HBeAg, meaning hepatitis B escape antigen, or you can also pronounce it as hepatitis B envelope antigen. Okay. Hepatitis B envelope or escape antigen. The next one we are going to have is situated on the core. Situated on the core. So on the core, we will have hepatitis B core antigen. Hepatitis B core antigen. For the hepatitis B core antigen, they are located on the core of the virus. They are located on the core of the virus. So as we interpret, would be saying something with regards to it. Unlike hepatitis B escape antigen, which we said by virtue of its ability to escape into the blood, it is referred to as hepatitis B escape antigen. Unfortunately for hepatitis B core antigen, they are unable to escape into the blood. So that means that should you take samples for hepatitis B serology, you won't be able to see the hepatitis B core antigen. Because of that, it lacks clinical significance. Okay. All right. So let's move ahead. The next thing we are going to be talking about is the various antigens that we just mentioned, the three, and their clinical significance. So let's start with the first one, which is hepatitis B surface antigen. For hepatitis B surface antigen, if it is positive, should you do a serology and it comes out positive, there are two reasons why it can be positive. Now let's look at the two reasons. The first one is if it is positive, it indicates an active hepatitis B viral infection, an active hepatitis B infection. Or the second reason is that when you look at vaccines, vaccines normally contain weak or dead particles that are given into the body to stimulate an immune response through the production of antibodies. So in that case, if somebody is given a hepatitis B vaccine, definitely it will contain the hepatitis B surface antigen, which will stimulate the body's immune system to produce antibodies. So the second reason why the hepatitis B surface antigen could be positive is when the patient or that particular individual has just received a vaccine, so recent vaccination. So these are the two reasons why hepatitis B surface antigen can be positive. Either the patient or the individual is having an active viral hepatitis B viral infection, or he or she has just received hepatitis B vaccine. Those are the two reasons why it could be positive. All right, so that's for hepatitis B surface antigen. The clinical significance of what hepatitis B surface antigen. Now let's move to the next one, that is hepatitis B escape antigen. For hepatitis B escape antigen, should it be positive? Should it be positive? If it is positive, it is telling you that the virus, that's the hepatitis B virus, is undergoing active replication. So for hepatitis B escape antigen to be positive, it denotes an active viral replication. Because of that, the hepatitis B escape antigen is considered a marker. It's considered a marker for viral replication, or infectivity. So if you go for any exam and a question is directed with regards to hepatitis B virus and you are being asked of the marker for viral replication, then you should think of what? Hepatitis B escape antigen. If it is positive, it tells you that the hepatitis B virus is actively replicating, it's actively reproducing, it's actively making new copies. That's what it means. And if that is the case, if it is actively making new copies, then the viral load, which refers to the direct count of the copies of the hepatitis B virus, will increase. And if it increases, then the chances of transmission of the virus to another individual is very high. So such patients have high rates of what? Transmissibility of the virus to another individual. So because of that, the hepatitis B escape antigen is also considered as a marker of viral replication. or as a marker of what? Infectivity, as we originally said. All right. Now, for the hepatitis B core antigen, as I already explained to you that unlike the hepatitis B escape antigen, which can escape into the blood, hepatitis B core antigen, unfortunately, cannot escape into the blood. Hence, should you do a hepatitis B serology, you will not be able to find the hepatitis B core antigen. So because of that, we will say the hepatitis B core antigen has no clinical significance. It has no clinical significance. It has no clinical significance. All right, so these that we said, they have to do with what? The antigens. They have to do with the antigens. I hope for now the concept about the antigens make sense to you. Now, let's move ahead. Since we've talked about the antigens, let's move ahead and talk about the antibodies. Let's take the first one. So antibodies, we know that they attack antigens. They bind to antigens to form what we call the antigen-antibody complexes, which could further open up the cascade of what? An immune reaction. Similarly, as observed in inflammations, as you know. All right. So, if we take this first one, which is here, you can see that the antibody is attaching to the hepatitis B surface antigen. Because of that, we will refer to it as what? The hepatitis B surface antibody. But there are several ways to represent this. Another way by which you can represent this is by saying immunoglobulin G against hepatitis B surface antigen in this manner. So either you are using the immunoglobulin G. Immunoglobulins, you should know that it refers to what? An antibody. So immunoglobulin G against hepatitis B surface antigen, okay, it's also considered as what? The hepatitis B surface antibody. That's another way to write it. Or you can still go ahead and write hepatitis B surface antibody. That's HB subscript S AB to denote hepatitis B surface antibody. So this or this is connotating to what? The hepatitis B surface antibody. Either you are writing it like this or you are writing it like this. They are all correct. Or another way you can also put this without bringing in the immunoglobulin. You should know, anytime you say antibody, it means antibodies work against antigens. So we can also say that then we'll bring the antigen, hepatitis B surface antigen. We can also bring it like this, anti-hepatitis B surface antigen, telling you that anti working against the antigen will be what? The antibody. So these are the three different ways by which you can represent the hepatitis B surface antibody. Okay. Now, let's move to the next one. We'll come back to the clinical significance of each of the antibodies. The next one will be the one that we've labeled here. As you can see, this antibody is going against the hepatitis B escape antigen. The antibody is working against hepatitis B escape antigen. So in that manner, we can see that this is what? Hepatitis B escape antibody. Or again, as we represented here, we can put it in those several forms. That is immunoglobulin G against hepatitis B escape antigen, or anti-hepatitis B escape antigen. So those are the three forms, as you know, just like we did for the hepatitis B surface antigen, the same way we are doing for hepatitis B escape antigen with regards to the antibody. Okay? So this we know we can call hepatitis B escape or envelope antibody. Okay, so that's the antibody against hepatitis B escape antigen. Now let's look at the last antibody. For the last antibody, which will be here, you can see that this particular one is working against the core antigen. So if it's working against the core antigen, then we can refer to it as what? Hepatitis B core antibody. Or, as we normally say, anti-hepatitis B core antigen, or immunoglobulin G against hepatitis B core antibody. But here, when it comes to hepatitis B core antibody, it is not always immunoglobulin G. The immunoglobulin G will come on later. So we can have immunoglobulin G or immunoglobulin M. Either of them is correct. You should know something about immunoglobulins. When it comes to immunoglobulins, with regards to abundance, then you should always think about what? Gamed. Where the highest. So it means that in this case, it is going to be what? If you are going from left to right, it's going to be decreasing in quantity. So in that case, we can see that the most abundant immunoglobulin in the human body is immunoglobulin G, followed by immunoglobulin A, followed by M, followed by E and D. The most abundant is immunoglobulin G. That should be clear to you, the most abundant. Why? Because it has a very long half-life. It takes a longer period for it to what? Be cleared from the body, unlike the rest. And also, its production takes at least 6 months of duration. So in the case of an acute infection, you will not see immunoglobulin G being produced. Rather, you are going to see immunoglobulin M being produced. That is the main reason why immunoglobulin M is considered as an acute phase reactant, meaning that in the case of an acute infection or conditions, the immunoglobulin that will be released first will be immunoglobulin M. So anywhere you see immunoglobulin M, know that that particular scenario or condition is in the acute phase. But the moment you see immunoglobulin G, then you should know that the condition has progressed to the chronic phase. So immunoglobulin M here connotes what? An acute infection. Immunoglobulin G definitely is telling you about a chronic infection. Okay? Okay. So this, as we are saying, is hepatitis B core antibody. We have hepatitis B surface antibody, which we describe here. Then you also have hepatitis B escape antibody. Now, let's explain their clinical relevance. So let's take the first one, which is hepatitis B surface antibody. So if the hepatitis B surface antibody is positive, again, just like we said, for the hepatitis B surface antigen, it could mean two things. The same way it will mean two things here as well. So the first one, if it is positive, it tells you that hepatitis B surface antibody, which can only come in the form of immunoglobulin G, has been able to clear the hepatitis B surface antigen. And we know that anytime hepatitis B surface antigen is positive, the first thing we think about is what? Infection. That would be hepatitis B viral infection. Or the patient has just received a vaccination or received a vaccine. And as we delve deeper, we will get to know when it is hepatitis B viral infection or when it is a recent vaccination. We'll get to know. Okay. So now, if this is positive, it could mean two things. The first one is the patient has become immune due to previous hepatitis B infection. Or another way we can put this is cured from previous hepatitis B infection. Okay, that's another way we can put this. Or the second reason is immune due to vaccination, meaning that the purpose for which the vaccine was given, which I told you from the start, that it was given to stimulate the body to produce antibodies, has been achieved. So you give hepatitis B vaccine, which contains hepatitis B surface antigen. It stimulates the immune system to produce immunoglobulins. That's the antibodies. Once it has been produced, which is going to be in the form of immunoglobulin G, then we will say that, okay, if he has immunoglobulin G in circulation, then it could mean that the patient has become immune due to the vaccination he or she has received. Okay? Now, so these are the two reasons why the hepatitis B surface antibody could be what? Positive. Let's move to the hepatitis B escape antibody. For the hepatitis B escape antibody, if it is positive, there's only one reason. It tells you if it is positive, it tells you that the virus has undergone a replication. It tells you that the virus has undergone replication. That's what it tells you. The virus has undergone replication. It means the virus has already replicated, has produced new and new copies. So that patient definitely has new and new copies within the circulation and can easily transmit it. Okay. Then the last one is a hepatitis B core antibody. Hepatitis B core antibody. For the hepatitis B core antibody, there are two reasons here. If it is positive, anytime hepatitis B core antibody is positive, know that that patient, whether currently or previously, has had the hepatitis B viral infection. It means that the moment it is positive, it means you have active. The moment the hepatitis B core antibody is positive, you should know that it's active or previous hepatitis B infection. So the moment you see hepatitis B core antibody positive, know that that patient has had or is currently having hepatitis B infection, either previously or currently. Whether it has been cured or not, we are not interested. The moment you see hepatitis B core antibody positive, it tells you that that patient has something to do with hepatitis B virus infection, hepatitis B viral infection. That's what it tells you. It has something to do with it. Now, this is the thing I was talking about. This is what is going to help you to know whether, if hepatitis B surface antibody is positive, whether it is the patient being cured from a previous hepatitis B infection or it is immune due to vaccination. The moment this is positive, hepatitis B core antibody is positive, know that that hepatitis B surface antibody that you are seeing, it is indicating that the patient has been cured from a previous hepatitis B viral infection and not vaccination. The only way by which you can say that the patient becomes immune due to vaccination is when the hepatitis B core antibody is negative, telling you that there has not been a scenario or situation of the viral infection before. There was no hepatitis B infection. Okay? Now, if it is possible, we are saying that, then it means there is an active or previous hepatitis B infection. And again, we have to look at the composition of the antibody. Is it immunoglobulin M or immunoglobulin G? So if it is immunoglobulin M, we should know. I already told you, immunoglobulin M is an acute phase reactant. Therefore, this is an acute infection. It means that it tells you that the patient is acutely infected. Because I already told you that once it's positive, then it means the patient is having hepatitis B viral infection or has had hepatitis B viral infection and has undergone what? Recovery. If the hepatitis B core antibody is positive and it is immunoglobulin G, then you should know that that is a chronic infection. That is a chronic infection. That is a chronic infection. Okay. So these are the understandings with regards to the antigen and the antibody. For the antigen, there are 3 of them, and out of the 3, only 2 have significances, clinical significances, which we explained. We said hepatitis B surface antigen, if positive, could mean 2 things. Could mean an active hepatitis B viral infection or a recent vaccination that the patient has taken. Then we went ahead and spoke about hepatitis B escape antigen, where we said it is located in the envelope. Because of that, it can also be regarded as well, hepatitis B envelope antigen. And we said anytime it is positive, it tells you of an active viral replication. Hence, it is considered as a marker of what? Active viral replication, or infectivity and infectivity. It tells you how, infectious the patient becomes and the probability of transmitting that infection to another patient. So if it is positive, yes, that chances of transmitting is very high. Then we went ahead and talked about the hepatitis B core antigen, where we said it is not clinically significant because those antigens, they are unable to leave the core into the circulation. Then we ended the descriptions or the understandings concerning the antigen. And we went ahead and talked about the antibodies. And we said hepatitis B surface antibody, which can be, and I told you how you can see it written. It can be written severally. And we said if it is positive, it could mean 2 things. It's either the patient has been cured from a previous hepatitis B infection or is immune due to what? A previous hepatitis B infection. And the second reason is the patient is immune due to vaccination, which he or she has received in the past. And we said to know which is which, we will have to look at the hepatitis B core antibody, where we say anytime hepatitis B core antibody is positive, it means the patient has had a hepatitis B infection, whether currently or previously. And that is where we are going to be able to distinguish a hepatitis B surface antibody which is positive in relation to whether it is indicating an immunity due to vaccination or an immunity due to previous infection. And definitely if hepatitis B core antibody is positive, it will favor an immunity due to a previous infection with regards to hepatitis B. Then we also looked at the hepatitis B escape antibody, and we said it's an indicator that the hepatitis B virus has undergone replication. So those are the understandings with regards to what? The hepatitis B antigens and antibodies. All right, let's move ahead.